And thank you for joining us. With us here is Dr. Amie Coffman, neurologist at Meadville Medical Center.
Hi.
Doctor, good to see you. Thank you so much for joining us. Tell us about yourself.
I've been a neurologist here for 5 years. I went to Duquesne for undergrad and LECOM for medical school. Trained in Erie as well, so I'm from the area and really have an interest in everything in neurology.
That's fantastic. What age did you know this is the path you wanted to take?
Well, actually, I took a different path. I was a pharmacist for many years. Then I decided to go back to medical school, and I fell in love with the specialty of neurology.
What was that moment like for you when you said, I'm going to do this?
It was something I always wanted to do, and when the time was right, it was, I just took the step.
Well, even pharmacy side of things, did you always have a passion for medicine or people or both?
Both. And I think one of the reasons I wanted to go move from pharmacy to medicine was to have more of the passion, or be able to interact with patients more.
It's probably one of those things too where every day's a little different for you.
Yes.
Every patient's different. What's that like to develop those relationships with your patients?
It's really nice. I have patients that I've been seeing since I've been in practice, and I'm very attached to them, and I really love the continuity of working with the same patients. And the variety too.
Yeah, well, and it sounds like there's also a love for Northwest Pennsylvania, going to Duquesne,
yes,
staying in Erie, coming here.
Yes, my husband and I have always said we're Pennsylvanians, and we can't really see ourselves living anywhere else. Maybe visiting, but not living.
Yeah. What sort of things do you enjoy about this area?
We like the Four Seasons. We like camping and outdoor activities, and sports fans.
So staying here was important to you?
Yes, very much.
How did you come to Meadville?
Well, it just kind of worked out when I finished training. Honestly, I really like the community type of hospital, the small feel, the personal feel. So I chose that over like a bigger university type setting.
So talk to us about neurology, the kinds of patients you see, and just again, it's every day's a little different.
Yeah, absolutely. So I'm a general neurologist, and so I see adults with variable neurological problems, ranging from migraines, stroke, Parkinson's, epilepsy, neuromuscular conditions, dementia. So definitely a lot of variety.
I would imagine with a lot of that, you're seeing the stress, the emotional side for families going through this with a loved one. Mm-hmm. So there's that aspect too.
Yeah, absolutely. Most of my patients will visit me with their family members, and it's a family event, to help the families too as best I can.
And some of that is probably genetic, right? Where maybe a trait would get passed down. Yeah.
And then, of course, the family, I help to direct the families to supports that they need in caring for their loved ones with neurological issues.
There's an event coming up in May that we're going to be talking about here in a little bit, but at what point does a patient get to your office? Is it through their primary care physician initially, or is it directly contacting you? How do you get your patients?
Most often their primary care physician will refer them, but once in a while you can also self-refer also. So
what type of symptoms would somebody recognize that they should say, you know what, maybe it's time to have that conversation?
So if a patient's having things like numbness, tingling, weakness in their extremities, tremors, seizure type activities, migraines that are very bothersome, trouble walking, memory problems, any of those.
Would you say even if it's something that they would just maybe brush off, maybe it'd be better to schedule an appointment and come and see you?
Yeah, absolutely. And we can kind of triage them and reassure that everything's looking okay, but keep them to watch for to come back if things change.
Because a lot of things can sort of mask other problems, and you may think, okay, maybe I'm not getting enough sleep, I'm just tired. Mm-hmm. But maybe that's not the case, or maybe it is.
Yeah, so we do help patients try to sort that out, especially maybe like one example might be memory problems. Someone thinks, I'm just getting a little older. This is natural. So we can kind of help, help them figure out what's normal and what's a little not normal.
Yeah, and it could be, even just a little shake, a little tremor, something like that, where you might say, okay, maybe it's a nerve, maybe, I hit my elbow off of something, or, something fell on me, whatever. That could be something else, mm-hmm. and this is just the start of maybe something that is more serious.
Right, yeah. So we're always happy to, see someone for something like that and reassure them and make sure nothing else is going on, or it's not going to get worse.
When you're working with a patient, and again, everybody's different, right? So you may see two patients with dementia, but the treatment or course of action could be way different from each other, right? Just because the patient's different.
Every patient's different, so we try. We have to tailor the treatment for each patient. Absolutely.
And I would imagine. Again, a lot of patience comes into play with those family members involved, because it's probably also very stressful for the patient themselves. Mm-hmm. But then to have the family concern, and I'm just thinking of dementia at the top of my mind at the moment, where you might be getting frustrated that they're not remembering, or they're asking the same questions over and over, but that patient also feels frustrated.
That's a big part of that condition. So education's important to, especially to the caregivers and family members, to let them know like what to expect, what when to pick your battles, to try to not make a big deal out of each thing, because it frustrates the patient too.
When it comes to technology and medicine and treatment, has a lot changed over the years? Mm-hmm. Is it getting better? Or, where are we now? Where are we going to be in 10 years from
mm-hmm.
now?
Oh yeah, there's a lot of new technology, neurology, like with stroke, there's different techniques in acute stroke. One of them we'll talk about maybe is called thrombectomy, to remove a clot from the brain. That's, advancement. There's surgical implants for Parkinson's, tremor, epilepsy, to treat those conditions.
I've seen videos on that. It is amazing.
It is.
They'll turn it on.
Yeah.
And off.
Yeah.
And that's a big difference.
It's fascinating, yes.
So who knows what's going to happen in the next 10 years.
Right. And also, they're doing work with stem cells for post-stroke recovery to help with limb recovery. So, and different devices to help with weak limbs after stroke, mechanical, robotic, yeah.
Sometimes I think there's maybe some confusion, heart attack, stroke. Mm-hmm. Share maybe some of the differences, or, what specifically stroke.
Okay, so stroke, there's two main types of stroke. One we call ischemic stroke, and then the other one is hemorrhagic, and that's the bleeding kind of stroke. And that's only about 10% of cases. The remaining 90% are the ischemic. And what happens there is there's an interruption in blood flow in an artery in the brain, typically by a clot, or piece of blood vessel broke off inside and blocked off a vessel. And so that is different than a heart attack, which is involved in the blood vessels on the heart.
Okay. And both serious.
Yes.
Needs to be taken care of. So, and sticking with stroke, they come in and what? Are you visiting them in the emergency room? Are they coming to you because they feel something's off?
Okay. Ideally, a patient that's having stroke symptoms, and that would be something like weakness, numbness, tingling that comes on suddenly in one limb, loss of vision, double vision, trouble speaking, slurred speech, trouble with balance. Any of these types of symptoms that come on very suddenly are definitely signs of stroke. And what needs to be done is the patient needs to get right to the emergency department via calling 911 because there's acute treatments available for that patient. They need to get to the emergency department.
So, again, every second counts there.
You lose, I think it's 4 million neurons a minute from stroke.
Wow. And there are times where people say, "Oh, that's not happening to me. It's got to be something else." But it's best to get into the hospital, get checked before it turns into something more serious.
Right. I always tell patients, get right in. If it's a false alarm, that's okay. We don't mind. We want to make sure we don't miss anything, and don't wait around to see if it goes away, because even if it does, that could be a warning sign that a stroke is coming.
There's a big event coming up on Saturday, May 4th. Mm-hmm. It's the Stroke Walk. Talk a little bit about that.
Yeah, so we're going to have lots of patients and stroke survivors and their families to do a walk in benefit awareness of stroke. There's going to be plenty of education, raffle baskets. It's a really nice time. So encourage everyone to come.
Blood pressure screenings taking place too. What are the stories like when you see those folks come back and take part in an event like this?
Oh yeah, it's really nice. Had a number of my patients come last year. They're very excited to have made recovery and able to still do the walk. Some of them are taking a little longer to do it, but they're they've made a lot of progress in their rehab, and proud to do it.
And that's the other side of it, right? The rehabilitation part, and it's amazing, and it's a good thing when they push themselves and have those goals, and they can say, "Hey, I'm going to take part in this." Yes,
it is.
And that's coming up on Saturday, May 4th, and folks can register by contacting the hospital. Is that?
They just need to come at 9:30.
Okay.
Yeah, for registration.
Great. And if there's questions, I think 814-333-5441 is the phone number that they can call. And again, refreshments, blood pressure screenings, education tables. What sort of information will be available?
Well, we're going to have education on the risk factors for stroke. So it's always good to know what kind of risk factors you might have.
Can you name a few?
Sure. Smoking, number one. The hypertension, high blood pressure, high cholesterol, diabetes, sleep apnea that's not treated, alcohol use, obesity, and decreased exercise. All those can definitely modify. In just smoking alone increases your risk of stroke by double.
Really?
Mm-hmm. That's why I said it first. Yep.
There you go. And I would imagine an event like this with the information, maybe if somebody has questions or they know they need to get on a healthier track in life, they could maybe get some of those answers on where to go to maybe start that process?
Yes, I'll be there, and a number of other resources from Meadville Medical Center will be there to help make referrals and answer questions. Yep.
That's fantastic. What do you do to relax?
Oh, I play with my dogs and cats.
Any hobbies?
Camping, fishing, reading.
Best place to camp?
Cook Forest.
Beautiful.
Easy.
Well,
Easy answer.
Yeah, but latest book you're reading?
Poldark.
Okay. Music?
I like everything. I like to go, my husband and I go to hard rock concerts. So Train, I like Train. They're local too.
Yeah. I like everything with you, Northwest Pennsylvania.
Yep.
That's great.
Born and bred.
Yeah. Well, Dr. Amie Coffman joining us. And again, the Stroke Walk taking place on Saturday, May 4th. And you can call 814-333-5441 or just show up. Registration 9:30 a.m. Walk will get underway at 10. Dr. Coffman, thank you so much for your time.
Thank you.
All right, and thank you for joining us.